Okay, Dr. Emil, hi. I'm the Assistant Director General of the Barzilai Medical Center, Ashkelon, Israel. During the last year, the 2007, we had many missiles launched to the Ashkelon area and the Sderot area. About 370 patients were brought here to the hospital. They were treated especially because due for acute stress injuries. During the year 2007, we had about 370 patients brought from Sderot and Ashkelon because of the missiles. Most of them suffer from acute stress disorders, but we had also very severe injuries. There were 2 deaths, and we had some patients who were severely injured in the head and shrapnels and everywhere. We had a patient also with a shrapnel in the heart. He had an emergency thoracotomy. I mean, his life was really saved here by the staff. He was diagnosed on the spot, and he was taken to the operating room and operated, and now he's feeling well, thanks God. Beside that, we also treat patients from Gaza. That's humanitarian. I mean, they send missiles here, and we treat them. That's the humanitarian side of Israel. It doesn't matter if he's from Gaza, if he's Muslim, he is Christian, it doesn't matter. We treat everyone. They are patients and they need treatment, and we offer them all the facilities that we can. In all the cases, we have injured, we have patients, heart problems, eye problems. All these are treated here in our hospital.
Over the last 2 weeks, there's been a particular rise in the number of Qassam rockets.
Yes, last week, I mean the 2 days, especially 2 days, there were missiles every 10 to 15 minutes. That was awful. Every time the paper bleeps, and every time we know that there might be some patients who will be brought here. Again, fortunately, there were no deaths. There were not severely injured patients. They were only mildly injured with some shrapnels. I mean, there was a patient, he was just lucky. He had a shrapnel in the head. She had a shrapnel in the head, but she was conscious, and she was transported to the to neurosurgery. She's doing well now. It's just luck.
And describe what it means to be a humanitarian.
To be humanitarian is to do your best medicine. It doesn't matter who you are. You are a patient, you need treatment, we do it. We are physicians, we are not politicians, we are physicians. And we give medicine to everyone who needs it. If it's an emergency or something else, we do it. Even you know, sometimes terrorists were brought here. Some terrorist who exploded himself, a suicide bomber. We treat him. It doesn't matter who he is. He is injured now, and we treat him.
Now, during the so-called blockade in the south in the last week, have you treated patients from Gaza?
Today also we have patients from Gaza. Some of them are injured, some of them are patients. We treat them all the time.
So they continue to come here today?
They continue to come here.
And patients from Sderot, what is your general advice to them as a doctor?
Sorry, it's not an advice from a doctor. They have just to continue their life. I don't know how. They are really brave people there. They are really brave people. I don't know how they live, how they continue their normal life, if you can say it as a normal life. I don't know, but they are brave. They continue their life there, they live there, they work there. I don't have any other word, just braves.
And your staff, what advice do you give to them with all this trauma?
We have to continue, treat all the patients, even with the trauma. I mean, there's a phrase that you say, who treats who will treat the staff who treats? Who will treat the staff? Receiving so many patients in acute stress disorder, it's awful to see such a patient. I mean, you just think it's just an acute stress disorder. No, it's not just an acute stress disorder. It will continue to post stress disorder. It will continue to all his life. It will change his life. It's awful to see these patients. And we have to be with all our forces to continue and treat these patients and give them what they need.
Thank you.
You're welcome.